Oh my God, I just gave my patient the wrong medication. What do I do now? No one saw me and my patient is okay. So do I need to report this? Over a 2-year period, patient safety incidents have caused over 200,000 potentially preventable deaths and cost the federal Medicare program over $8 million. In 2008 alone, medical errors cost the U.S. economy $19.5 billion.
Did you know that the state of Connecticut lists 29 serious medical mistakes that are mandated to be reported to the Department of Public Health? Of these, 16 are directly attributable to nursing errors. Examples include giving the wrong meds, giving the wrong blood type, and stage 3 or 4 pressure ulcers acquired after admission. In Connecticut, errors must be reported by hospitals in writing within 7 days, and a corrective action plan must be filed within 30 days. 25 other states have enacted similar laws, but in a nationwide survey, only 46% of nurses believe that all drug errors are actually reported.
Nurses list reasons for not reporting errors as fear of management and peer reactions, fear of losing their job, time pressures, and lack of harm to the patient. In addition, when they did report a mistake, they received little feedback, reinforcing a perception that reporting an error is not meaningful. The psychological trauma caused by committing a medication error can be overwhelming to a nurse. Their first concern is the patient. They may feel upset, guilty, or terrified about having made an error. They can also experience a loss of confidence in their clinical practice abilities and feel angry at themselves and at the system.
Current clinical literature advocates open communication among the healthcare team. If there is a nursing error, members of the healthcare team meet to discuss how the error occurred, how it can be avoided in the future, and how it can be disclosed to the patient. This approach creates an environment of teamwork as opposed to the nurse feeling like he or she has to deal with the problem alone. Typically, the attending physician then discloses the error to the patient.
Medical malpractice insurance companies bear the costs associated with medical errors. In some states, they are pulling out of the market, leaving physicians either uninsured or with higher premiums. Loss of reasonable malpractice insurance for providers could eventually turn into loss of affordable, accessible health care. To alleviate these problems, medical malpractice insurers will favor alternative dispute resolution, patient safety efforts, and tort reform.
Some tort reform advocates say an apology can help providers avoid malpractice lawsuits, especially when combined with an upfront settlement offer. For example, the University of Michigan Health System has such a process in place. They handle medical errors by taking the initiative to discuss what happened with patients and families. They also conduct their own investigation and offer apologies and compensation if the investigation reveals medical errors. Some might think that being this upfront about what happened might cause more problems. However, in actuality, legal costs, the number of new lawsuits, and the number of claims dropped after the hospital began this program.
Nursing errors are reported to state authorities. Each state has a large volume of information that could be used to develop new strategies to prevent medical errors. The National Council of State Boards of Nursing has a project underway to compile a national database from all of this information. This database would include a classification of errors, root cause analysis, and practice responsibility. The goal is that this database can be used to put safety measures in place to prevent future nursing errors.
Yes, I need to tell someone about this. Let me go find my supervisor so we can report this correctly.